method of hands-on, hands-off healing is important that you do not have any sweeping actions or stroking actions. This would lead to an indication of forms of manipulation. It is important at all times that your client is happy with you in the way that you treat them. So first I will demonstrate how we would go ahead and treat a person sitting in a chair. The most important part of this particular way of treating the patient or client is to make sure that they are comfortably seated. Are you comfortably seated?
Yes.
It's also important to remember that it could be a client from a young child to an elderly person. This does have its advantages and disadvantages. The process is to lay the hands gently onto the shoulder, already knowing what the patient has said is wrong with them. But to always start the treatment from the shoulders, making sure that when you place your hands on the shoulders, they are placed in a light position. So you are putting your hands gently onto the shoulders, not to disturb the person, but also to make them feel comfortable. You do not need to put pressure, as the energy will flow. Once you have ascertained the beginning of the treatment and the patient has said to you that they maybe have a problem with their right arm, you can then move on to the arm. By placing your hands either side of this position, of which the patient said she had problems with her right elbow, this allows the energy to go completely through the elbow. When you feel comfortable that timing has finished, remove the hands and place them back onto the shoulders in the gentle fashion already described. It is very important to make sure that the client is comfortable with every movement that you make. Everything can be done slowly and positive. Remember, you are giving a professional approach. The disadvantages is a person of an elderly age, which may, with the relaxing feeling, start to go to sleep. In this case, the patient might start moving over to one side, and then you have to try and hold them in that position. It doesn't interrupt with the healing, but it does make it more difficult. The energy will still flow whichever way it is done. Therefore, trying to bring the patient back and holding on to them makes it more difficult for you. Those are the only difficult situations that we may say in the chair position. It is also very important to indicate to the patient that you have finished the session, either by once removing the hands and just gently touching the shoulders, or just by tapping them on the shoulder. This you would have already mentioned at the beginning of the session to the client so that they have that understanding. Before the client moves from the chair, before they get up, make sure that they are not dizzy. Ask the patient, do you feel okay?
Yes.
And also ask, would you like some water?
No, thank you.
This is important, as with the energy, it can dry out the mouth as well as making your patient feel dizzy or uneasy. Always make sure that you are happy with the well-being of the patient.